The human body often shows subtle signs of serious health problems, and when it comes to stroke, early recognition of warning signs is crucial for immediate intervention. Strokes, often called brain attacks, occur when blood flow to the brain is interrupted, causing damage to brain cells. Although strokes can happen suddenly, there are often warning signs that precede the event. Understanding these signs can be a key factor in preventing or reducing the effects of a stroke. In this video, we will explore the 10 warning signs of a stroke a week before it happens. Difficulty sleeping. Sleep is a fundamental aspect of overall health, and disturbances in sleep patterns can serve as a subtle but significant warning sign of potential stroke risk. Recent studies have clarified the intricate relationship between sleep quality and cardiovascular health. Sleep disturbances, including difficulty falling or staying asleep, can be a cause of high blood pressure and other cardiovascular problems, increasing susceptibility to strokes. Sleep disorders such as sleep apnea, characterized by interruptions in breathing during sleep, have been linked to an increased risk of stroke. Intermittent oxygen deprivation associated with sleep apnea can lead to changes in blood pressure and oxygen levels, creating an environment ripe for the development of stroke. Recognizing the importance of addressing sleep concerns is critical as they can serve as early indicators of underlying cardiovascular problems. Changes in mood or behavior. Subtle changes in mood or behavior can serve as early indicators of neurological problems that could lead to a stroke. Sudden irritability, unexplained emotional swings, or changes in cognitive function may signal disturbances in brain function. Recognition of these changes and their potential link to stroke risk emphasizes the need for a comprehensive medical evaluation to identify and address underlying concerns. Changes in mood and behavior can be associated with conditions such as depression, anxiety, or even cognitive impairment, all of which can have vascular or neurological origins. Dizziness or vertigo. A feeling of dizziness or vertigo that begins suddenly can be more than a momentary discomfort. This could mean impaired blood circulation in the brain. These episodes can result from transient ischemic attacks, TIAs, often called mini strokes. TIAs are warning signs that should not be ignored, as they indicate a temporary interruption of blood flow to the brain, increasing the urgency for immediate medical attention. Dizziness can also be associated with conditions such as orthostatic hypotension, in which blood pressure drops significantly when standing. Understanding the complex nature of dizziness as a possible indication of more serious neurological events highlights the need for monitoring and investigation of these symptoms. Speech changes. Speech impairments, including slurred speech or difficulty forming words, are classic indicators of stroke. The brain's language centers depend on consistent blood flow, and any disruption can lead to noticeable changes in speech patterns. Recognizing these changes and seeking immediate medical care can make a substantial difference in the outcome of a potential stroke, as timely intervention can minimize long-term neurological damage. Changes in speech can also manifest as difficulty understanding spoken language or expressing thoughts coherently. These linguistic challenges highlight the intricate relationship between neurological function and stroke risk, reinforcing the urgency of addressing speech-related warning signs. Unexplained fatigue. Persistent and unexplained fatigue can go beyond everyday tiredness. It can be a subtle but quite serious warning sign of an impending stroke. Fatigue, when not attributed to lifestyle factors or temporary stressors, may be indicative of underlying cardiovascular or neurological concerns. Understanding the potential link between unusual tiredness and stroke risk highlights the importance of investigating fatigue as more than just a consequence of a busy lifestyle. Fatigue can be associated with conditions such as anemia, sleep disorders, or heart problems, all of which can contribute to an increased risk of stroke. Recognizing fatigue as a potential warning sign emphasizes the need for a comprehensive medical evaluation to identify and address contributing factors. Persistent headaches. Although headaches are a common ailment, persistent and severe headaches that deviate from an individual's typical patterns deserve attention. These headaches may be symptomatic of vascular changes that increase the risk of stroke. Monitoring the nature, frequency, and intensity of headaches becomes crucial in identifying patterns that may indicate underlying problems that require medical intervention. Headaches associated with stroke are often characterized by sudden onset and severe intensity. They may be accompanied by other neurological symptoms, such as dizziness or visual disturbances. Understanding the nuanced nature of headaches as potential precursors to stroke events underscores the importance of distinguishing between routine headaches and those that may signal increased cardiovascular risk. Numbness or tingling. Numbness or tingling sensations, especially on one side of the body, can be uncomfortable and indicate neurological problems. These sensations often result from compromised blood flow or nerve function, highlighting the need for timely medical evaluation. Such symptoms may be associated with conditions, such as peripheral arterial disease, or carotid artery stenosis, both of which contribute to an increased risk of stroke. Numbness or tingling can appear in various parts of the body, including the face, arms, or legs. Recognizing these sensory changes as potential indicators of underlying vascular problems reinforces the importance of seeking medical care to evaluate and treat neurological problems. Increased blood pressure. High blood pressure, or hypertension, is a well-established risk factor for stroke. Blood pressure measures the force of blood against artery walls, and consistently high levels can cause vascular damage. This damage, in turn, increases the likelihood of a stroke. Regular blood pressure monitoring is crucial, as it allows timely identification of hypertension and facilitates effective management through lifestyle modifications or medication. High blood pressure can result from several factors, including genetics, lifestyle choices, and underlying health conditions. Changes in heart rate. Irregular heartbeats or palpitations can be indicative of underlying cardiovascular problems that can contribute to your risk of stroke. Conditions such as atrial fibrillation, characterized by irregular heart rhythms, can lead to the formation of blood clots, increasing the likelihood of stroke. Monitoring heart rate and identifying any abnormalities are essential steps in managing cardiovascular health and reducing your risk of stroke. Changes in heart rate can be influenced by lifestyle factors, underlying heart disease, or other systemic problems. Vision disturbances. Changes in vision, including blurred vision, sudden loss of vision, or visual disturbances, may be associated with impending stroke events. These symptoms can result from compromised blood flow to the eyes, or other neurological factors that affect visual processing. Recognizing the importance of changes in vision as potential indicators of impending stroke underscores the importance of seeking immediate medical attention if such changes occur. Visual disturbances associated with strokes can affect one or both eyes and can be accompanied by other neurological symptoms. Recognizing the warning signs of a stroke involves a nuanced understanding of various symptoms that can manifest individually or collectively. While these signs can serve as potential indicators, it is crucial to emphasize that experiencing one or more of these symptoms does not guarantee that a stroke will occur. Seeking immediate medical attention and consulting healthcare professionals are essential steps in addressing and managing potential stroke risks. Individuals concerned about their health or experiencing specific symptoms should consult a qualified healthcare professional for a complete evaluation and appropriate guidance. This information is not a substitute for professional medical advice, diagnosis, or treatment. I trust that you enjoyed the content, and click on the like button, subscribe to the channel, enable notifications, and share the video with your friends and family.